Hi, hello, welcome. This is Nursing Guru. Myself, Manoj. Today I came up with a wonderful and which is most basic thing in our nursing profession, especially in the clinical sector. Okay, so today we are going to see the important topic, that is nursing diagnosis, that would be helpful all the nursing professions, especially the GNM, BSc, post-BSc as well as MSc students. So let's move to the video now. Yeah, nursing diagnosis. So today we're gonna see with the 5 important topics that covers under the nursing diagnosis. Firstly, the introduction, definition, and the types of nursing diagnosis and components that comes under the nursing diagnosis. And finally, how do we frame those components and types in nursing diagnosis so that it could be an exact framed nursing diagnosis. Yes, before moving to the definition of nursing diagnosis, we have to know what is meant by NANDA, because NANDA is a main criteria that comes under the nursing diagnosis. So NANDA is nothing but North American Nursing Diagnosis Association. So this is a criteria which is very important in framing the nursing diagnosis. It has given few important components that we will be seeing later. So let's know about what is NANDA. So NANDA, which was officially founded in 1982, it provides a complete standardization and organization of nurses that helps and interested in framing and standardizing the nursing terminologies. So this is what the NANDA actually does in its association. So with this, according to NANDA in the year 1990, NANDA gave the nursing diagnosis definition as nursing diagnosis is a clinical judgment of an individual, family, as well as a community response to both an actual as well as the potential health problems as well as the life processes. So let's see an importance of nursing diagnosis. So what does this nursing diagnosis actually do and why it is important in nursing profession? Because nursing diagnosis provides the basis for the selection of nursing interventions that are important in our nursing care. So and it enrolls the nursing care of 24 hours so that the entire process will be like components as well as the standardized form. So it provides the basis for the selection of nursing interventions to achieve the outcome for which the nurse is responsible. So next, let's see the types of nursing diagnosis. Actually, there are 2 types of nursing diagnosis. Firstly, the actual nursing diagnosis, and second one is the potential nursing diagnosis. Here, we have to make a note that actual nursing diagnosis will always follow a criteria, as I said earlier, a components. Okay, so the components and criteria are correlated here. The nursing diagnosis with only for the actual nursing diagnosis that follows is 3-part statement. This 3-part statement of nursing diagnosis are also said to be a component, which is also known as PES format. Okay, P stands for problem, E stands for etiology, and S stands for signs and symptoms. Here you will be thinking, what does this PES format mean? Okay, P, as I said earlier, it is a problem. It will be a patient problem. Okay, and E stands for etiology. It represents or correlates or relates the causes as well as the risk factors. And finally, the S stands for signs and symptoms, that defines the characteristics that are manifested by the client. Okay, this components, that is P, E, S, plays a major role in framing a nursing diagnosis, especially the actual nursing diagnosis. Okay, now let's see an example that suits very well for the actual nursing diagnosis. Let's start with the system wise. So according to the priority, always remember that nursing diagnosis always goes with the priority. So in system wise as well, we have to see for priority. So first thing, we always look for the respiratory system. So let's take a respiratory system that very well suits in nursing diagnosis. So let's take an example that ineffective breathing pattern related to excessive secretions as evidenced by coughing, wheezing or dyspnea. Hopefully you all know what is meant by dyspnea, right? Dyspnea is nothing but a breathing difficulty. So this is a nursing diagnosis where I will divide a component so that you can understand. Here, ineffective breathing pattern, this will stand for a problem, okay? The problem in this nursing diagnosis is ineffective breathing pattern. Related to stands for the etiology. As I said earlier, always etiology means the causes or the risk factors. So, ineffective breathing pattern is a problem related to excessive secretion. Related to excessive secretion will stand for etiology, and third is S, that is signs and symptoms. Here the signs and symptoms in this nursing diagnosis is as evidenced by. Always signs and symptoms is evidence based. So you have to look for as evidenced by. Here as evidenced by is wheezing, coughing and dyspnea. So in this nursing diagnosis, you can see all three components which I said earlier, that is P, E, S format. So I hope now you got one example in the respiratory system which is very clear now. Now let's see the second system so that you will be more familiar with that. Second prioritized nursing diagnosis as well as the system that suits for is cardiac system. So in cardiac system, let's take one more example that very well suits in nursing diagnosis. Decreased cardiac output related to decreased cardiac contractility as evidenced by low blood pressure. Here you can see again I have used related to as evidenced by. Here the nursing diagnosis is again divided as compartments. Okay, so as I said earlier, the P, that is the problem, here is in cardiac system which I took as an example, is decreased cardiac output is a problem, and next we have to look for is an etiology. Here in this example, what is etiology? Related to decreased cardiac output related to cardiac contractility. Related to cardiac contractility is an etiology here, and next is the signs and symptoms. Here what is the signs and symptom? It is very visible here. Low blood pressure as evidenced by low blood pressure is an signs and symptoms in these three components. So it is very clear there is a P format, E format and S format. So with all these three, again hopefully I think you have been clear with all your doubts how you can frame by using these three components in actual nursing diagnosis. So I have given two system wise nursing diagnosis example. If required, we'll go with one more example, that is next prioritized system we have done with respiratory, cardiac, and next will be the gastrointestinal system, that is GI system. So this will stand for the third prioritized nursing diagnosis, imbalanced nutrition less than body requirements as related to anorexia or some metabolic activities or disturbances as evidenced by lack of appetite. Lack of appetite is nothing but the anorexia, okay? Here, imbalanced nutrition less than body requirements will be a problem, patient's problem, related to metabolic disturbance. This is the main cause why the patient had imbalanced nutrition. Okay, this will be the etiology, and third, the signs and symptoms part is anorexia. Anorexia is nothing but a nursing terminology or medical terminology that defines the lack of appetite. So lack of appetite is a signs and symptom that we can see in this nursing diagnosis. So this is also one more example that we can see for actual nursing diagnosis that very well suits for. And let's take a fourth system which is very important in elimination, that is genitourinary elimination system. Okay, in this again we will be looking for actual nursing diagnosis is nothing but a direct thing that we are looking for instead of predicting one. So during the assessment or nursing assessment, what we are holding with, so at that time what we are assessing will always suits for the actual nursing diagnosis. So the genitourinary system will give a best example that impaired urinary elimination related to mechanical obstruction of urinary bladder as evidenced by low urine output. Okay, here again it has three compartments. Firstly, the problem is impaired urinary elimination, and second, the etiology is mechanical obstruction of urinary bladder. So related to, always keep in mind that whenever there is a related to RT related to mechanical urinary obstruction, you have to look for an etiology. And third is the signs and symptoms. Signs and symptoms is always an evidence based. So wherever if you see as evidence, it is a signs and symptoms. Here the signs and symptoms in this example is low urinary output. So there is a P format, E format, and also the S format. So again it is a complete framed nursing diagnosis. And the last but not least, the final system that we are going to look for is musculoskeletal system. In this system, we are gonna frame a best example that suits here as a nursing diagnosis is acute or chronic pain related to a disease condition that might be a trauma, fracture, or whatever it may be, as evidenced by verbalization of a patient or facial expression of the patient, which was very discomfort and fatigue. Here, as earlier what we have seen in PES format, here again we will take that format in this example as well. Here the P stands, that is the problem what we are looking for is acute or chronic pain, and etiology what we are looking here is related to fracture. What I have said, disease condition, either it may be any disease condition which is related to musculoskeletal. Here what we are going to impose is fracture or trauma. These are the etiology that we have imposed in this example. And finally the signs and symptoms. Here the signs and symptoms what we are looking for is the fatigue or discomfort or the patient verbalization of the pain or facial expression of the pain. So this will be done by the visual analog scale, which is a scale where the patient will be looking in front of him and the facial expression will be read out. So according to that, the pain will be analyzed. Here again you have all seen what is the PES format in musculoskeletal system that we have given in this example. Okay, so these are the systems that actually suits in actual nursing diagnosis, which have done with 5 systems. And next we'll move on to potential nursing diagnosis. Here you can say that why this NANDA nursing diagnosis only suits for the actual nursing diagnosis, why it is not for potential nursing diagnosis. You can raise a question to me, but as I said earlier, this PES format will always suits here. Whereas the high risk, why it is not? Because high risk or potential is nothing but the high risk, which is the prediction. High risk will always be a prediction here. So you're assuming, you're predicting it that it gonna happen. So in this case, the PES format will never suits here. Always the PES format will comes under the actual nursing diagnosis. So what are the examples that we can look into high risk nursing diagnosis? Let's say, let me give you one example. So firstly, we'll take a high risk, the patient which has undergone the surgery. Okay, how do we frame this condition in this nursing diagnosis? First thing, let's say high risk, which is a problem here, related to surgery or a procedure, whatever procedure, it may be a cardiac or oral surgery or whatever it may be. High risk for bleeding related to cardiac or any surgery. Here there will not be any evidence. Why it is not imposed here that PES format is because this is evidence-less nursing diagnosis. Here you will not be proving anything. Always keep in mind that nursing diagnosis is very evidence based. Not only the nursing diagnosis, whatever the practices that we are following in our nursing profession are completely evidence based that we are following in our modern nursing. Hopefully you got what that has to be imposed in actual nursing potential, actual nursing diagnosis and potential nursing diagnosis as well. Potential nursing diagnosis is completely different, where you will not be using a PES format and only it will be a prediction part. Okay, so as I said earlier, here don't use any PES format or don't use any related to as evidenced by, only there will be a P and E. That is problem which I have given in this example is high risk for bleeding is a problem that patient has, and etiology is a cause or risk factor. What is the risk factor? Here risk factor is completely the prediction one. Okay, it is mainly because of the surgery that patient had undergone. Since it is a prediction, there will not be an evidence. So as I said earlier, there will not be a PS format to the potential nursing diagnosis, and it stands only for the actual nursing diagnosis. So I think now we have come to an end. In today's topic, we have discussed the introduction of nursing diagnosis and the definition of NANDA nursing diagnosis, which is approved by NANDA Association, North American Nursing Diagnosis Association, which was founded officially in 1982, and it gave the definition of the nursing diagnosis in 1990. So from 1982, you can see that the nursing is completely evidence based. So now it is how to say, now it is completely modern nursing. So it is completely based on the nursing NANDA. The association which always the nursing follows is NANDA. Okay. So we have seen the introduction part, definition part, and types, that is mainly the actual and potential nursing diagnosis, and the components. Please remember these components, that is 3-part statement which I have mentioned earlier. PES format. P is problem, E is etiology, and S is signs and symptoms that defines the characteristics of patient that are manifested, okay, manifested by the client. PES format. And finally, how do we frame nursing diagnosis? By keeping these 3 components. We have seen with each system examples, starting from respiratory, cardiac, and gastrointestinal, genitourinary, and finally the musculoskeletal as well. And as well as the potential nursing diagnosis, I gave few examples so that you will be cleared out. Hopefully you do have, I think have been cleared all your doubts, and I'm full with my topic. If anything that you feel difficult, or if you have any queries, please do comment in the comment chat. Thank you.